everyone, welcome to yet another session of PLAB2NHS. This open session was conducted by Dr. Kalpita, where 4 brave candidates participated in an open mock discussion. In this video, there are only 3 stations unfortunately which we could only manage to record, and we do apologize if there is any disturbance during the session. Hopefully, this will be a learning video and we all can take some pointers and utilize them in our OSCE practice and during our PLAB2 stations. Let's begin.
Yes, doctor. I was actually expecting your call.
Okay. And is it the number that I would like to call you back in case the line cuts off?
Yes, definitely.
Okay. Okay. How may I help you, Mrs. Watson?
Doctor, I'm just really tired. I mean, all my life I've been told, I'm big boned, but the last couple of years, people have been, very mean to me. They've been calling me fat for a very long time. And now I just can't stand it anymore.
Oh, I can't imagine how you're going through now, right now. So, since how long have you been feeling tired?
Doctor, I'm not sure if you heard me right. I said I'm tired of being called fat.
Okay, sorry. Okay. Since when do you feel that you have been gaining weight?
I mean, I've always been a bit big, but probably in the last 3 years, after I had my first child, I've been gaining weight like crazy.
Okay. And could you just tell me, like, how much have you gained so far?
Probably about 8 kilos, doctor.
Okay. And all right. And how do you find difficulty to sleep at night?
No, doctor, not really. I can sleep pretty well.
Okay. And do you have any weather preference?
No, I feel just fine.
Okay. And do you have any symptoms?
Like what, doctor? I mean, I feel fine. It's just that, I mean, everywhere, wherever you look, Instagram, Facebook, people just keep talking about fitness, but it's so difficult. I mean, it's not that easy. I have tried a fat diet, and I mean, it's called a caveman diet, where you only eat for 4 hours and you are fasting for the next 20 hours. But I'm still not losing weight.
Okay, Mrs. Watson, I've seen that you've taken some effort to reduce your weight. It's a good thing you've done. Let's see how we can do it more constructively.
Okay,
So
doctor.
I need to ask you a few more questions.
All right.
Have you been diagnosed with any medical condition in the past?
No, doctor. I've been quite lucky that way. I've had no issue.
Okay. And have you been taking any medications or any herbal medicines?
No, doctor.
Okay. And any allergies?
No, doctor.
Okay. Um, has any member of the family been diagnosed with any medical illnesses?
Well, my dad has diabetes mellitus and BP, and he actually had a heart attack when he was 57 years old.
Oh, I'm
I'm
sorry
a
to
bit
hear.
worried about that. I mean, would that happen to me as well? I mean, everyone in the family has always been fat.
Oh, I see where you're coming from, Mrs. Watson. And how is your father doing now?
He's fine, doctor, but he's quite weak after the heart attack. I mean, sometimes it can be a struggle for him to move around.
Okay. Okay, does he go to the GP regularly?
Not really. I mean, I don't really have much of an health issue, so I don't really visit the GP.
Okay, all right. Okay, coming back to you, I need to ask a few questions regarding your periods.
All
How are
right,
your
doctor.
periods?
Okay, fine, doctor. No complaints here.
Okay, when was your last menstrual period?
A week ago.
Okay, and do you use any kind of contraception?
No, doctor.
Okay, and are and have you done your pap smear?
Yes, about 2 years ago. It was fine.
Glad to know that. And I would like to ask a few questions regarding your lifestyle. Do you smoke?
No, doctor. I used to until 6 years ago, but I stopped.
It's great that you have stopped. Uh, I appreciate it. And do you take alcohol?
No, doctor. I do not drink now.
Okay, good. And may I know how's your diet?
I mean,
2 minutes
I feel my
remaining.
diet's quite healthy. I mean, I try to eat healthy. I'll have probably a good size bowl of porridge in the morning and then have a chocolate bar in the afternoon. And yeah, mostly I try to eat healthy.
Okay, I see. And do you consider yourself physically active?
Yes, I have two dogs, so I do take them out for walks in the evening.
Okay, that's good. So thanks for answering all my questions. Now, with your permission, I would like to do a general physical examination, check your vitals, including blood pressure and other parameters. And I would like to examine your neck as well as your abdomen as well. And I would like to run some blood tests, including thyroid function test and full blood count. Is that okay with you?
All right, doctor.
Okay. Thanks for the finding. Okay. Mrs. Watson, from uh, we have analyzed your weight and height, and we have found that you're on the higher side of your weight, which is called obese. Are you with me?
Yes, doctor. But what can I do? I mean, nothing seems to work.
Okay. Yeah, I see that you've made an effort and see that I think it's not working. But what we can do is, I will refer you to a dietitian so that they'll taper you a proper diet. Don't need to go for according to food fads and all. And it's good that you maintain exercise. And one more thing is that keep exercising daily. It's not that exercise only will reduce your waist length. It also reduces your fat within your body. So that's also more important, and that also will keep your body healthy.
Move on to the next station.
Thank you, Dr. Bright.
You're welcome.
How did you do the station? What do you think?
I felt like I just came to know it was telephonic conversation after the slide moved away. Then okay, then I suddenly became shocked. Then I couldn't get much of the DDs quickly.
Okay.
I should have asked her mood, I think so. And I forgot about the main thing is body mass index. I forgot to mention weight and height.
Right.
Then
So,
although I was wondering like she's doing all this diet and exercise, I don't know how to manage further.
okay. All right. We'll explore that. Does anyone have anything to add on to this? Do you feel this could have been done any differently?
Just ask about concern. She's concerned about losing weight, and maybe you should ask her about methods that she tried before to lose weight and what challenges she faced, something like that. You know, by any chance her mood is affected. Try to support her more. She's concerned about heart attack. Maybe at some point you can talk with her about Q risk. We will at some point we can do risk like assessment for you to know whether you're susceptible for future events like that, and come to this point later. But just reflect this point, something like that. But you did.
Right. So I don't know who that was, but I think you pretty much summed up the station in a really nice manner. Hello, Dr. Bright, can you hear me?
Yes, yes.
So to begin off with, when it comes to history, I think we mostly touched upon everything. I didn't really have any symptoms, but I did have concerns. And as someone already has mentioned, that you should have probably tried to explore more about that, and you should have tried to address that more, because I was really worried about uh, heart attacks. And coming to history taking, okay, I know you did all the 4 Ps and everything. We could have probably done that a bit more quicker. You seem to take a lot more time, and it was slightly unstructured, the history. I'm sorry, there seems to be some disturbance. Can somebody mute that, please? Thank you so much. Um, right. And also, I was wondering, you never did a screening for diabetes mellitus, did you? Did you check for
No,
her blood
no,
sugars?
no,
Yeah,
no, no.
that is also very, very important. And uh, I did kept telling you I have gone in for these fat diets. You should have probably told me that these things are risky, especially when I told you I eat only for 4 hours, and then like 20 hours I'm not eating anything. All these things do carry risk. You should have probably tried to explain about that. And I did say I have 2 dogs and I walk them, but I didn't tell you how far I walk with them, right? So you
Yeah.
still don't know how much exercise I could be putting in. I mean, I told you my diet is healthy, and then I told you I have a good bowl, like a good size bowl of porridge, and then I have a huge bar of chocolate. So that should have probably been a cue that I am probably an unreliable patient that way, right?
I was wondering if I focus more on the like my time was very less that time when I take the diet history as well as exercise history, and I should have explored more. So how could I have done that? My father had an heart attack, so I was. So should I rush the patient or should I just move on slowly?
No, no, definitely do not rush the patient. Please do not do that. Uh, More important part would have been, I mean, especially when it comes to your IPS, which does carry a lot of marks, is you should have picked up on the cues when I told you I'm a bit worried. You know, my father's had a heart attack. You probably did not need to ask about how am I feeling about it, or how is he doing and all, because I obviously said that happened when he was 57. I'm just worried about it. So you probably could have just taken that cue and gone forward with it, rather than
Okay.
waste your time. It was a little bit like beating around the bush when you kept asking about your father. And
Okay.
it's a good thing you did appreciate that she's put in efforts, and you should encourage her more. And of course, when it comes to management, you should probably, of course, speak more on the fact that diet changes as well as exercise both should be done in conjunction to help her lose weight. And you could have probably referred her to certain programs. They do have programs like upbeat programs, and I think it's called a couch task running plan. There are podcasts which help come up with like a structured plan to try and help these people lose weight.
Okay. Okay.
Do we have any questions from anyone, or if anyone wants to add on to whatever I just said?
I don't see any questions there, but Julie has written some management points. So, blood test to ensure there is no other medical condition causing this obesity. If required, bariatric surgery is an option. Psychiatry liaison to help cope up with the mental health, and if it's morbid obesity, physiotherapy and occupational therapist as well.
Right. Those are good points. He didn't really explore the point about mood, so I guess that didn't come. Oh, one more thing. Please do not talk about waist length. Probably not a good choice of words.
Okay. Okay.
Begin.
Hello.
Hello. Hi, doctor.
Hi, James. I'm Noor, one of the doctors here. How are you?
I'm doing well. How have you been?
How's your shift so far?
Oh God, doctor, you know, especially with this COVID, I mean, it's all been so hectic now.
Yeah, I can really understand. Sometimes it's really hectic and exhausting. Are you coping well?
I mean, we are all doing the best we can, right?
Yeah, much responsibility, but I'm sure, yeah, we can go through this soon together.
Yes,
Well, James, at any time, if you need any support, any help, do not hesitate to ask, okay?
that's really kind of you, doctor. Thank you so much for offering.
Yeah, I just wanted to highlight that we are here working in a team. We are here for each other. Yeah, at any time, feel free to approach any one of the members. We're here for each other.
Of
Uh,
course.
yeah, James, I arranged this meeting because I wanted to talk with you privately. So would that be alright to have a couple of minutes with you?
I mean, yeah, sure, doctor. Is there some problem?
Well, the thing is, I just noted that you left the note on the desk, and yeah, I just wanted to give you a notice about that. Do not take it personally. Sometimes things like that could happen.
A note, doctor. What note are you speaking about?
Yeah, well, it's a list of patients' details, the one that we write about patients' information and so on.
Oh, I mean, I have no idea when this happened. I mean, must have slipped my attention. Where is that note now, doctor?
Well, it's okay. We can go now and we can check over these lists whether it's there or well, let me know whether usually where do you put your list when you finish reviewing your patients? Is there any specific place?
No, I mean, I do shred them to pieces and that's when I leave. I mean, you can't just leave these notes lying around, right? I am quite cognizant of that.
Well, yeah, do not take it personally. As I told you, sometimes this happen. Is it okay to just double check the list of your patients if you don't mind?
Sure, doctor. You can do that.
Yeah, this is really nice of you, James, to accept this notice. Yeah, as I told you, do not take it personally. Sometimes this could happen. Uh, James, let me tell you that at any time, if you feel that you're not, feeling well enough to work, it's okay to have a break and to tell one of the team members.
Yes, doctor, but I feel quite fine.
Yeah, I'm glad that you're feeling fine at the moment. James, actually, I'm a little bit concerned about you because the thing is, I realized that I can smell alcohol out of you. And
Where now, doctor?
James, I'm a little bit concerned because I'm not the only one who've noticed this. Other colleagues also did. So,
Who are these other colleagues?
yeah, actually, um, yeah, they noticed this too. But, let me tell you that our discussion today is just between me and you. And yes, of course, the senior should have an idea about what happened, but uh, you're
Doctor, what are you speaking of? I'm asking you, when did you smell of this alcohol? Who are these colleagues who have noticed it along with you? And now you want to include a senior. I mean, these are serious allegations.
yeah, well, you're right. Please, I don't want you to feel upset or worried or even angry about this. Okay, let's take it from here to analyze what happened, and I'm here to listen from you. But you're not judged here. You're here supported, and everyone can go through this. So, can you tell me, whether you work today under the influence of alcohol, James?
No, doctor.
Okay.
I find it quite upsetting that you would even ask me that. I would never compromise our patient safety.
Yeah, well, I can see clearly that you're keen on patient safety, and yeah, this is our job. People are putting their life within our hands. So, yeah, I can clearly see that you do know that we are dealing with people's lives. That's why I'm here to talk to you today, to know more from you. It's better to hear from others. It's not better to hear from others rather hearing from you yourself, James. So, um, can you tell me? I'm here to help you. If you don't mind to explain this smell of alcohol.
I mean, when was this, doctor? I mean, I definitely can't smell alcohol on me today. I'm not sure when are you speaking of.
Yeah. Well, it also happened in the evening rounds yesterday.
Oh, yesterday. Oh, I can tell you about that. I mean, I had popped out during the lunch break and somebody spilled wine on me. Oh, that's probably the smell you got.
Okay. Well, um, okay. Let me tell you that yeah, sometimes accidents happen, but you're not accused here. We just want to know. Uh, you know, we can't compromise patient safety. Patients are our priority, and if any one of the team are going through hard times, or even working under the influence of alcohol, we can do something regarding this. We need to support our team members. We know that we are going through a lot, so we are here for you. You're not alone in this. We want to move this forward, and we want to sort out this, James.
I mean, I appreciate your concern, doctor. I have been drinking quite a bit lately, but I can promise you I do not come here and ever put our patients' lives in danger.
Okay, James. Well, I can clearly see that. Yeah, we're not getting to a point. That's why I would involve my senior.
Right, doctor. I'm so sorry for giving you a hard time.
No,
Uh, I was just
actually,
waiting for
I
that
find
one
that really
particular
difficult.
word. If you had probably given it to me, I would have buckled. I'm so sorry for that. But
Okay,
these patients, they do tend to,
really challenging.
yeah. So, how do you feel you did?
I found it really hard, accusing someone that he's working under influence of alcohol and he's not responsible. And yeah, I try to, earn his trust in few minutes. It's difficult. He can lose his job with such act. This is really challenging situation. And yeah, anyone in my colleague position would feel the same. Like, am I accused here? I'm about to lose my job. No, I would lie. I would do anything, but I would not, admit that I did this. No. Yeah. So you have the right to be defensive. I
Right.
felt so. Yeah.
Okay. Um, does anyone else feel they could have done this differently?
Dr. Kalpita, this is a very kind of difficult stations among all
Right.
PLAB2 stations. So this is a very challenging station. So the main thing is that colleague is not going to open up for about 6 minutes.
Of
Anyone,
course.
if the simulator like you did and you didn't open up at the end as well. So what is the tip in that scenario? That do we need to scare him in that way? Like if he's not opening up even after building the so much rapport that I think that Dr. Noor has built up. So even after building up the so much rapport, if he's not opening up to you, so what next should we have to do?
Okay. Well, if I was the candidate here, how I would have gone about this thing is, Dr. Noor, first of all, did wonderfully. I mean, PLAB2 is a lot about testing your nerves, and she held her, uh, this till the very end, which is wonderful. But what I would have done in this scenario is, I would have probably not gone straight to the jugular just yet. Like, she immediately said, like, she kind of spoke about how hectic the shift is, and at the very beginning, she made a blanket statement that we are all here for each other, and that I can always ask for help. See, it sounded slightly scripted to me, maybe because in most of these alcohol colleague stations, you're making it sound like, the simulator will have some stress at work probably, and that is why he's doing what he's doing something like this. She never really asked me how are things at home, how are things otherwise. That's when I probably would have opened up, because the way I had planned the station is, the second somebody would ask me how are things otherwise, I would probably say that things are not going well at home. I have two children, and now my wife has been, diagnosed with fibromyalgia, and she's not really working much. And with this whole COVID situation, it's, you know, really problematic. And I'm hurting, and then she would have probably asked me, oh, how are you coping, you know, with something like this. And that's when I probably would have said, oh, doctor, I don't really want to speak about it, but I've been drinking a bit too much alcohol. And that would be an opening for her to then say something like, oh, you know what, I didn't want to bring it up this way, but yes, I did smell alcohol on you. Directly accusing a person that, oh, I smelled alcohol on you, and other colleagues have noticed, and which is why I kept saying these are serious allegations. You cannot just tell me that point blank. You have to try and understand what I am going through. And you cannot just directly tell me, oh, I'm going to go to the senior with this. You have not yet finished a discussion with me. I think a lot of ethical scenarios in PLAB 1, PLAB 2 speak of whenever you have an issue or a problem with a colleague, you should first talk about it with the colleague, try to understand the situation, try to help them, then escalate it to somebody else. And then you can give that explanation that I do need to escalate this probably, because I know you wouldn't want to compromise patient safety, but you have been a bit reckless. I mean, sorry, maybe wrong choice of word. You have been a bit careless. You left a note lying around. These details could have fallen into wrong hands, and we don't want that, right? Uh, are you all with me so far?
Yes, doctor. But I'm here also assuming that he's going through hard time and that's why he's drinking. Maybe he likes alcohol. That's why.
That
And
could also be the scenario.
Dr.
Also,
yeah,
Noor, Dr.
yeah,
Noor, as your statement, as you said, that you are assuming.
yeah,
So instead of that, why don't you put forward a question and let him answer whatever he wishes to?
yeah. I want to know more about how can I let my colleague open up and trust me to open up and to tell me what's going on with him.
So
How
of
can
course,
I do that?
as you know that one of like you see scenarios can vary from what we are doing and what comes in the examination. Even in the examination, there are multiple scenarios of the same topic. So once you know that you have explored about the work and he says that everything is
Yeah,
fine, look somewhere else. Look, how has your like have you been meeting up with your family? Have you visited your family recently? How are things at home? How about your friends? So look outside the work since he said that the work is going fine. There
yeah,
will be
great.
some
I will
trigger.
do that.
Yeah, there will be some trigger somewhere where he will try to open up. And even if he doesn't open up, maybe he's instructed not to open up in that scenario, I guess.
Yeah, I'm
that can
really
definitely
thankful. Thank you, doctors. Appreciate this opportunity. Thank you.
Well, most welcome, Dr. Noor.
And I'm
One more
so sorry
question.
for giving you a hard time.
I have a question. Like here, you said I will not open up directly, and you will give up like a trigger point of stress at home. So we deal with like a case as a stress. So we ask as a third person when people are stressed and to drink a lot, low mood. So we should go in that way.
You can probably throw in a question about mood. Maybe that could also have been the trigger point here. If I was saying, things are going fine at work. I mean, it's just hectic. But, the things you see in the hospital nowadays, especially with the given scenario, please be cognizant there's a pandemic happening out there. So I could probably have that also as an effect on me, and I could have a low mood. So if she had asked me, how has your mood been lately? I probably could have told her even then.
Okay.
I mean, there are multiple ways to approach the station. Anything that I say here, any of the doctors who tell you, ones who have, completed their PLAB 2 and they tell you, oh, this is the way, that is the way, always take it with a pinch of salt and try to see what approach you are most comfortable with. Because this is not one glove fits all scenario when it comes to PLAB, right?
Okay. And could you please like guide us how like if colleague is addicted with the drugs or like alcohol, how we should start? Like how we can frame the questions.
Well, as I said, speak about. I mean, one of the common things you can touch upon is firstly stress. Ask them how have things been at work, at home, and otherwise if they're facing any other issues. Uh, uh, and then you can probably, they'll tell you what has been happening with them. Then, you can speak to them, and I would have probably asked him, don't you feel that, if you come here and you're working under influence, don't you feel that this might compromise patient safety? So put the ball in his court or her court. Like let them tell you, yes, I do realize that, and uh, I do not want to do something like that. I do not want to endanger the lives of my patients. So what can I do? Then you can probably talk to them about support services. There are doctor support groups. You'll have in-house in the hospital. You'll have such groups. They could probably go in for an occupational health review. Also ask them about, have you had some time to take off for yourself in the recent few days? You're planning on just like taking a small vacation, just sitting back at home and just chilling for a while or something on those lines. So try and ask them things like that. So it'll show like you are actually being supported. You really do care about this person, and you of course care about how they are working in the hospital, because eventually patient safety is the priority here.
Can I ask, for example, if we started the case like you said, I mean, we asked the family support and friends, and he always said there's nothing, nothing, nothing. He didn't want to open up, and afterwards he might not, for example, open up. And what could be our approach? Is it a wrong approach to say, for example, we will have your blood tests and we will search for anything, for anything if something happens? And should we try? I mean, threatening them as a yeah,
No,
poison.
no. Please
Something
not
like
threaten
this.
your colleagues. I don't think that bodes well. No, please do not threaten them. I'm sure they will open up. In case they're not opening up, you're probably, you haven't got onto that trigger word or the point yet. But no, threatening does not work.
Okay. This is
That's
not the way
probably
you
not.
say.
No, I think as FY2s, that's probably not up to you either. I mean, you can always escalate it probably to a senior, but please try talking to them first, try to understand, and then let them know. Don't like threaten them that, oh, I'm going to now go and let the seniors know about this. That also doesn't work. You'll find they'll get more defensive and more difficult. And
Okay, for example, there is in drug addicted patients. Don't we say we will take blood tests from you? We will search for the drugs. Do we
No.
do we do the same thing for the alcohol as well? I mean,
No. I mean, in drugs, I'm sorry, I didn't quite catch that. You're saying in the drug scenario, you will be taking a blood sample? Hello?
yes. And for example, if our colleague is taking drugs or not, and he will be assessed for drug taking, for cocaine, heroin, what is it? And according to the results, and they're having a decision about if he will continue or not. This is my understanding. I don't know so much.
I mean, if I was in that situation, I wouldn't recommend doing a blood test even for that drug scenario. I mean, that is definitely not, it's way above our pay grade. That's probably something hospital might do. I mean, if patient safety has been compromised, that's way too complicated. I would never bring up a blood test to check for alcohol, drugs, or anything for that matter.
We do only you say to escalate to the seniors, and they will.
Yeah, I mean that's really on them. For us at our level, we probably just try to speak, speak about support services. Nothing too threatening or scary.
For example, if it is the case, the colleague is saying, please don't escalate for this time. I quitted alcohol. I'm fully aware of what's happening. I won't say anything. Don't say it to my senior. What should we say in this case?
I'd probably say I appreciate the fact that you have acknowledged the problem, and you are ready to give this up. And I know you being you'll probably not repeat this, but this still needs to be escalated. I mean, this is a serious matter if you're leaving patient details around carelessly. And you could probably also say that we need to go back and review the patient files and review the work you've done to make sure nothing untoward has happened. Because if you worked under influence, your senses may have been blunted, so your decision making may have been compromised. So we need to work on that, and we do need to let our consultant or a senior know about it. I mean, it's not to threaten them or say that, oh, the senior is going to fire you about it or something, but more like, it's always best to bring in that senior who will also provide extra support. Maybe they would know what else could be done. Probably give that doctor some time off, maybe, because that's all he might need at the end of the day.
Okay, thank you.
Hello,
Hello.
hello, hello. I am Deepika, one of the junior doctor in the GP surgery. Can I take your name and age, please?
I'm Margaret Hatcher, doctor. I'm 62 years old.
Hello, Margaret. How are you doing?
Not so well, doctor.
What happened, Margaret?
Doctor, it's this pain in my right arm. I mean, it's been there for a week now and I just can't bear it. It's too much.
Oh, I'm so sorry to hear this. So, since how long you are having this pain?
Since a week, doctor.
Okay. So, can you tell me more about this pain?
It's just there throughout the day. I don't know, doctor. It's just a very sharp pain that's just there and I'm not able to move my hand much and it's just unbearable.
Oh, Margaret, is the pain going anywhere else?
No, doctor, just on my arm, the right arm.
Okay. And can you score this pain for me? One being the lowest.
I would probably say 8.
Oh, it must be very hard for you, Margaret.
It is, doctor. It really is.
Yeah, how you coping?
I mean, the doctor I'd met before had given me some medications, but that's not really helping me somehow. And
Okay.
I've tried to put some hot water bags on it, but that also does not provide much relief.
Yeah, I see. So is it in your right or left or in both hands?
No, doctor, just a right arm.
Okay, right arm. Oh, I'm so sorry to hear this. And I can see from your notes that you have this COPD. Is that correct?
Yes, doctor, that's been there for a good 40 years now. I'm taking salbutamol for it, and I manage it fine.
Okay. Any chest pain?
No, doctor.
Okay. Any shortness of breath?
No, doctor.
Or any other complaint other than this pain in the arm?
Doctor, I mean, I've been feeling a bit constipated as well for 3 days now.
Okay. Is it worsened from past 3 days?
Yes, I guess I would say so.
Okay. And anything make it better?
No, doctor, nothing seems to be making it better.
Okay. And you are okay. And are you diagnosed? Are you on any other medication?
Yes, doctor. I mean, they gave me morphine for the pain, but that's not helping.
Okay. All right. And you have and are you diagnosed with any other condition?
Oh, doctor, wasn't that in my notes? I have lung cancer as well.
Yes. So what are you taking for that?
They said they'll start me off on radiotherapy in about 2 weeks' time. And they said, I mean, the cancer has spread. So they said because of that, I might be having the pain. So they've given me morphine for it. But it's obviously not working.
Okay. And may I ask how is your diet?
My diet's well, doctor. I mean, I've been eating more healthy since my diagnosis.
Okay. And what about your physical activity?
I do go on walks, but since last week, my arm has been paining too much. So I've been confined to the bed.
Yeah, I see. And can I ask, are you sleeping and eating well?
I do feel my appetite has gone down, but sleeping not so well. I mean, the pain keeps me up.
Yeah, it is very hard. And how is your mood, Margaret?
I mean, it's quite low, doctor.
Oh, I see. If you have to score your mood from 1 to 10, 1 being the lowest, where would you score it?
A 5, doctor.
All right. And do you have any support, any close by in your family or friends?
Oh, I'm living with my daughter. She takes good care of me.
That's good. So, Margaret, now is it okay if I check your vitals and do general physical examination?
Yes, doctor.
Thank you, Margaret. Uh, do you have somebody around?
Somebody around, doctor?
All right, Mark. Somebody near, any close by?
My daughter's there. I mean,
Okay.
is there a problem, doctor?
Margaret, you are diagnosed with cancer, right?
Yes.
Lung cancer. So your lung cancer has spread. Okay.
Right. I'm aware of that.
Yeah. So team of doctors think that radiotherapy uh, is the ultimate, treatment for your lung cancer.
I know that, doctor. They told me that the radiotherapy will help with my pain, but it's still 2 weeks away and I'm in a lot of pain at the moment.
Yeah, radiotherapy will help you in ease out the pain. Are you
Okay.
with me?
Yes, doctor.
So now the doctors think that radiotherapy, and you would be given palliative care. Do you know about palliative care?
No, doctor. I'm not sure I do.
So palliative care means to make you comfortable. So to relieve your pain. Does that make sense?
Yes. So are you going to be giving me something for the pain now?
We will give you radiotherapy to relieve your pain. Okay.
Mm-hmm. Okay, doctor.
Okay, and this palliative care is a holistic care, not to take care of you, like it will take care of you psychologically, socially, physically. Are you with me?
Yes, doctor. I am.
So do you have any concern?
Move on to the next station.
Oh, okay, Dr. Deepika. So how was it for you?
Okay, I thought patient doesn't know about this cancer, but patient knows about it.
Yeah, she knows. It's been written, has been diagnosed with metastatic lung cancer. My concern was actually the pain. My concern wasn't the diagnosis. I told you I'm aware of it. I already told you at the very beginning I do have lung cancer and it has gone here and there. My main concern was actually the pain, the constipation. So, yeah. Did you understand the station, Dr. Deepika?
So patient has COPD earlier, and now
Yeah.
she got and so why there is COPD and metastatic lung cancer, both things.
She is a known case of COPD and now she has lung cancer. I mean, that can happen, right?
Yeah.
They aren't totally two different entities that cannot coexist. No, so COPD was just for you to, it's something like an extra detail. That's it. The more
Okay.
important part here was that I have concerns. I have come to your clinic with concerns. You were mainly supposed to manage that. And I did keep telling you I'm in a lot of pain. You explained palliative radiotherapy to me and all. And I did say that, but that's 2 weeks away. I have pain right now. So the primary things for you to be doing here was manage my pain. Because that was what was the problem here.
So palliative care would start in 2 weeks, but now she is in pain. So the doctor's job is to relieve her pain through any painkiller.
Yes, I mean, she's already on morphine. So
Yeah.
I probably would, if I was doing this case, if I had to manage this, I'd probably, and she does speak of constipation. So that is one of the side effects of morphine. Am I right?
Right.
So obviously, and if morphine's not helping, so I probably will have to increase the dose. Now, that is something I wouldn't be able to do it completely by myself. So I would say something like, oh, I'm going to include, or I'm going to take a senior's input and we will try to increase your dose. But you are also facing constipation, which can happen due to morphine. So I would then probably speak about how I'm going to give her medication for it. Or, I would also advise her to have probably more water. And then I'll try to understand if she has any more side effects of morphine, things like that. I know when I mention palliative radiotherapy, I mean to say that it is still 2 weeks away. So how will you handle the pain for these 2 weeks? Because she's obviously in a lot of pain, she's in a lot of discomfort. You have to make her comfortable right now.
Okay. So now the task actually is to make her comfortable through his pain relief and constipation. So I need to talk about this radiotherapy? Yes, she knows about this radiotherapy already.
Yes, so you don't need to expand on it much. I mean,
Okay.
you did give me an explanation of it, so that is all right. But the main thing was managing the pain and the constipation.
Okay.
Basically, any concerns which she would say, because she has come with concerns, it could be any concerns. So the main thing is to address the concern.
Does anyone have anything else to add to this? Do you think y'all, anyone else could have done this a bit more differently?
And should we ask, like, how is she managing her day-to-day activities? Is she like McMillanders, or she need any social support?
Yeah, it's always good to ask that. I mean, she did say, Dr. Deepika did ask if I had any support, and I did tell her that, yes, I have a daughter who's helping me out and all. So, yes, but other than that, it's always good, especially for cancer patients, it's good to offer support. Ask them about it if if you're in touch with any of the local support groups and otherwise. And one of the other things I would have definitely asked is if she is driving by herself, because she has pain in her right upper arm, which can be problematic for her to drive home. And also, she's taking morphine. So, if she has any of the other effects of morphine, that is dizziness or a blunted sense and things like that. And I would also prescribe laxatives for the constipation, of course, the pain medications. I'll probably even try to explain, if I had the time, about breakthrough pain. So, other than morphine, she needs to be given something else to cover that little period where the morphine's going to be refractory.
Dr. Jayas asks, can we say we will review your medication in pharmacy to increase the dose and increase the pain ladder? You can just say that we can involve the pain management team who will be looking after and probably change the medication. That would be enough.
Yeah.
Because of course
Yes.
we can't change the medication, although we know that we can move right to the ladder to fentanyl, but we can't do that. So either we can involve the pain management team, or we can say that we'll inform our seniors who will come and probably review your medication, and we can see what we can do to help you with your pain. But since you have started for the constipation, we'll give you laxatives.
Right.
So as we say in the management for any patient, even in medical station, symptomatic treatment is a must which we should not miss in any station. So even in the station, the patient has come up with concerns. Whatever the concerns are, that is more important to answer. But rest all, I felt Dr. Deepika did well. Probably
Yes,
she was a
she
bit
definitely.
confused, but she really did well. Anyone else? So that was the end of the 4 stations. I think Kalpita would tell something more about it. Yes, Kalpita, to you.
So, firstly, let me thank you all. I honestly think it's very brave to come up on a public forum and actually practice. I never did that. I never could. I never had the courage. So, that's really great y'all did. I feel y'all have actually done quite a bit. There were things that I've learned from y'all today, which I wish I knew before my exam. And of course, as I said, you will have these patients. I have tried to change them, from the common scripts that are out there. So, when I went in for my exam, I was in for a couple of shocks, and which was why I tried to simulate that kind of scenario.
Thank you for watching. Stay tuned for more videos. See you guys next time.